Good evening, everybody. My name is Nel Wieman, and I am originally from Mishipiwitik First Nation, which is in Treaty 5 territory, part of the Anishinaabe Nation. And I'm joining you this evening from the traditional, ancestral, and unceded homelands of the Coast Salish people, including the Musqueam, Squamish, and Tsleil-Waututh Nations. I'm honored to serve as the Chief Medical Officer at the First Nations Health Authority, and I also am going to share my perspectives this evening on belonging and aging from my perspective as a psychiatrist by training and all of the different work that I've been involved in over the course of my career, clinical and as an advocate for the health system in different regions of this country where I've been so privileged to work. So one of the things I think for us as First Nations people that's important to know is our elders. We really value our elders, and every generation in a family or a community has roles to play that are important, and elders want to remain at home for as long as possible, and they want to remain in their communities. They have strong ties to their immediate families, extended families, and communities. They would like to continue to participate in cultural activities, ceremony. And one of the things I have heard elders mention is they really feel that having access to traditional foods in many cases is very important to them. So that if they leave the community for any reason, that this can disrupt all of those connections, both physical, emotional, spiritual, and mental. So communities themselves also want people and elders to remain in their communities. And I think it's important for me at this point to clarify that, there are First Nations people, for example, who live in larger urban settings, but where I work now in the province of BC, there are many rural, remote, and isolated communities. And so this is partly the perspective that I'm speaking of. So elders want to remain in their communities, but conversely, communities would like to keep their elders at home and in their community, especially for the younger generation. The elders are a source of cultural teachings and ancestral knowledge. And when elders are forced for any reason to leave the community, so for example, if their medical needs, physical needs become such that they need to enter into more assisted living or long-term care facilities, in general, those facilities aren't available in communities. I'm only aware of a very few number of long-term care facilities that exist in First Nations communities across the country. And so that source of sort of passing down knowledge from elder to younger person, the people who will eventually grow up to be elders themselves, is lost. The other thing around placement or having to move out of your community in order to seek more services or assisted living or long-term care, placement in these situations is not ideal as well. Elders mentioned, for example, feeling very isolated, having fewer visits. Transportation costs between a rural or remote community to a larger urban center is actually quite expensive and prohibitive for some families. But probably when we're talking about aging and belonging, one of the most important factors is that loss of connection. The other thing I will mention is that elders are sometimes reluctant to seek medical services or more intensive forms of support because of widespread systemic racism and a lack of cultural safety in those services. And we know here in BC from the In Plain Sight report that racism is widespread in our health system, health and social service system. The other thing I'll just briefly mention is sometimes there are language barriers involved. So some of our elders speak their language as their first and only language or have limited grasp of English. That can be a real barrier when seeking care outside of the community. And lastly, I think I'll speak just from a health system point of view, and I think I've already partly alluded to this, is that in many rural, remote, and isolated communities, there is a complete lack of services, supportive services, assisted services, or they're actually non-existent altogether. And this relates to sort of, that there's not enough resources available. Health human resources are an important factor, financial resources, and a lack of infrastructure. And so the delivery of complex care in First Nations communities remains a challenge. But I will end by telling you a little story about, and I think about how elders want to pass down that ancestral knowledge. And I have the privilege of working with so many wonderful, wonderful elders. But we are facing a public health emergency here in BC, the toxic drug crisis. And naloxone training, for example, is one thing that can be helpful, can keep someone alive who has experienced a poisoning. We have an elders gathering, a First Nations elders gathering here every summer. And for the last 2 summers, they have asked specifically to be trained in this life-saving harm reduction technique. And I just think that's a way of showing the sort of back and forth intergenerational caring that happens, that the elders are literally caring for younger people, and younger people look up to elders for that cultural continuity. So thank you very much.